So today we're going to be talking about the tib-fib exam. It includes the AP and the lateral tib-fib. I have my technique chart out open to the tib-fib section. I have already set my control panel, so I'm going to check the AP and the lateral, making sure that I have the right KB and the right mass, the right focal spot, and we're going to be on tabletop. I have covered my mouse and my exposure button with Clorox wipes so that when I have my gloves on, I will not contaminate those. I don't have to keep on changing them in and out. I can also have a rad bag over my plates if they are available. If not, I'll have to clean them off before I put them in the reader. So I already have a plate in the room. I'm going to grab my gloves. I already have a 14 by 17 in the room. Now with the tib-fib, it's going to be a 48-inch SID. And the reason why we use a 48-inch instead of the 40 is to ensure that we can get both the ankle joint and the knee joint on our image. So we're also going to catty corner. So I'm going to have her ankle at one corner and her knee joint at the other corner, because with that 48-inch and catty cornering, we should be able to achieve both joints on the image receptor. Now, if not, some of your clinical sites will say to get the joint of interest on the big film and then go back and get the joint that you missed on a smaller film. So I'm going to have the patient raise their leg up, and I'm going to place this, slide this leg out of the way here. I'm going to place this underneath her, and I'm going to adjust this. I'm just going to raise this up, and I'm trying to be ever so gentle as I'm adjusting this to ensure that I'm not causing any more pain or injury to her. Now, as far as removing any artifacts, if the patient has any jeans, anything, any metal that's going to be covering the tib-fib area, anything of that nature needs to be removed. Any ankle bracelets, any jewelry, or metallic piercings, anything like that that would show up. So we're going to go mid-shaft of the tibia. Like I said, I want to ensure that I'm at a 48-inch SID, so I'm going to raise this up to the highest point. And I'm still not there, so I can lower my table down until I reach my 48-inch SID. Once I have that, I'm going to collimate a mid-shaft of her tibia. I have the ankle joint included. I have her knee joint included. I want to ensure that I have light field side to side, so I'm not clipping any pertinent anatomy. She's in a true AP. I'm going to place my marker on the lateral aspect with it pointing down this way, because you're going to hang from the knee down on your monitor. I'm then going to shield my patient. Now this is easier done with the patient laying down, but if your patient happens to be upright, you would want them to turn and look away from the x-ray beam. I like to have my patient laying flat because that reduces the dose to the eyes and to the thyroid, because they're further away from the beam. I'm then going to measure, and this is going to be cold and hard, from your central ray, entrance to exit. I will then take this to verify that I have the correct technique. I want you to hold very still for me. So I'm going to look at the technique that I have already set according to the centimeters here and match it up, which I'm good. I'm going to go ahead and make my exposure. Hold very still, don't move, beep, you can relax. All right, I'm going to take my new plate, my calipers. I'm going to get a wipe so I can clean the plate if I have not put it in a rad bag. Now I'm going to do the lateral. Ma'am, if you could go ahead and roll up onto your left hip, roll up towards me so you're facing me. Bring this leg back behind you and raise this leg up so I can get this underneath. There we go, perfect. Okay, I'm going to put this shield over your lap once again. And I'm just going to try and feed it in there a little bit over her gonadal area. Once again, I want to be mid-shaft of the tib-fib, so I'm going to turn my tube so that it's going along with the long axis of her tib-fib. I'm ensuring that I have the ankle joint and the knee joint still visible. I don't have to check my SID because nothing has changed as far as that's concerned. I'm going to place my marker anterior to the part. I'm palpating the Malay line to ensure they're on there, and I'm going to palpate the condyles of the femur to ensure that they are truly perpendicular to the plate so that her tib fib will be in a true lateral position. Okay? I'm going to measure my patient. Center once again, hold very still, ma'am. I'm going to take my plate and I'm going to have my wipe in between my gloves and the plate, so my gloves are not touching, we're clean, and I'm holding my calipers so I don't lose the measurement. Now I'm going to verify, and I'm good. Hold very still, beep, you can relax. And that concludes the AP and lateral tib fib.